Hello, my name is Carolyn Savage, and I'm a respiratory therapist with ConnectWell Lung Health and Rehab Program. Today, we'll be looking at the first module in a series of four called What is Asthma? So, asthma is really an inflammation disorder of the airways. It is swelling inside the breathing tubes of the lungs that comes and goes, and it affects the structure and the function of the airways, how the lungs work, making them really become hyper responsive or really sensitive when people are breathing, but also varying how much air can go in and out of the lungs when people breathe. The common symptoms of asthma include wheezing, shortness of breath, cough, chest tightness, and mucus production. And the cough in particular can happen occasionally during the day or only at night. Symptoms can be variable, meaning happening off and on, or they can be persistent, depending on how much swelling is happening in the airways and what's going on in the airways. What happens in the airways is really something that is important to understand when we think about the symptoms that people can feel. So, looking at the image on the left, comparing a normal airway to an airway that has asthma. What happens essentially is the muscles around the outside of the airways tighten, making it harder for the air, of course, to get in and out of the lungs and can lead to the symptom of chest tightness. Inside the airways become red and swollen. So this is really the main action that happens for people with asthma. That swelling really can close the airways, making it very hard to breathe. And with that swelling, often the body tries to fight whatever's irritating the lungs, and mucus can be produced. So that leads to lots of coughing, wheezing, and really lots of shortness of breath with all of those things happening in the lungs. Asthma is often inherited, meaning there's a family history of as others in the family with asthma or a significant allergic reaction. Asthma can also develop in some people based on the things that they've been exposed to in their environment or workplace. Some people can develop asthma as a result of smoking or secondhand smoke exposure. And anybody can develop asthma at any time. So it's not just children, but adults can develop asthma for the first time as well. Uh, the severity of asthma can vary over time from having no symptoms at all to mild, moderate, or severe symptoms. How people feel their asthma can be very different. Asthma is diagnosed by a simple breathing test called spirometry. This test involves breathing out, in and out as fast as you can to measure how open your airways are. So measuring the lung volumes and the air flows that are happening within your lungs. Often the test is performed with an inhaler given in the middle of the test so that the breathing can be measured before and after a puffer is given to see if the airways can be opened more. And if criteria is measured, meaning more airway opening has happened because of that blue puffer, then it can be a diagnosis of asthma. Another way to diagnose asthma, if that breathing test does not show it, but maybe symptoms or something is leading your health provider to think that asthma is present, is a test called the methicillin challenge test. This is really a test that's only done within a hospital setting typically, and it's a test that measures how responsive your airways are when they're being irritated by something. So methacholine is actually a histamine that is breathed in by a mist during the test. And after each dose of his methacholine, the breathing is measured. So again, looking for how hyper responsive or how reactive the airways are is part of that test. And if the breathing changes as part of that test, then certainly, again, a diagnosis of asthma could be attained. So at this time, that is the gold standard for diagnosing asthma if the breathing tests don't show it. Getting a diagnosis for asthma is so important to make sure that symptoms are really shown to be from the lungs, because lots of other things, health conditions, can cause similar symptoms, but also making sure that the treatment is appropriate for asthma. So do talk to your healthcare provider if you're feeling asthma symptoms or you think you may have asthma, and make sure those breathing tests are done. Other factors to consider about diagnosing asthma can really include a good family history, should include a good family history, your health history also, including any chest infections or breathing flare-ups you may have had, needing the emergency room or antibiotics, for example. A good physical exam may be done by your health provider, a good understanding or history of your work history, your workplace exposure to any chemicals or irritants that may have influenced your breathing, your smoking history, your secondhand smoke exposure history. Also, an x-ray or blood work may be done to really look at the different aspects of your breathing and the inflammation markers that may show up in the blood work. And allergy testing may also be considered by your healthcare provider depending on your symptoms. The Canadian Thoracic Society publishes regularly the most up-to-date guidelines for your healthcare provider on how to diagnose asthma and how to manage asthma. And this is really so important for you to understand really that there is a process involved to diagnosing asthma and what options there are. The first, again, step in diagnosing asthma is getting those breathing tests done. And those breathing tests also can be used to monitor asthma over time or monitor any changes that happened if inhalers or medication is started. The secondary factor is really making sure your airways are protected through the environment that you're in. Quitting smoking is very important, and a good education and a plan in place so that you can manage your asthma well going forward. So please talk again with your healthcare provider if you want more information on that, or if you feel that you want this investigated for yourself. The next module includes talking about asthma triggers, and I hope you can join us for that.